In this section, we're going to talk about some diagnostic tests for urinary tract diseases. The first one we're going to talk about is the KUB. This is the kidney, ureter, bladders. Okay? It IDs the normal structures, and it's an X-ray exam without contrast of the kidneys, ureter, and bladder. It demonstrates the size and location of the kidneys in relation to other organs in the abdominopelvic region. The next one is a urinary catheterization. This is when you can see the soft tube is placed in the bladder. It goes through the urethra. And we use it to drain the bladder, collect sterile urine sample, treat incontinence, or instill medications. Now that is done actually with what's called an in and out cath or a straight cath. The one that you see in here right now is a Foley cath. See, they have the little balloon on the end that keeps it in place. This is also called an indwelling catheter, okay? And it's inflated with either air or liquid. The next thing we're going to talk about is a urinalysis. This, one of the ways we perform this, we do a dipstick. So there is a stick that is impregnated with several different chemicals. Each little pad has a different chemical on it. And it tests things such as bilirubin, blood, protein, leukocyte esterase, what else? pH, specific gravity, nitrites. Okay, and all it is we're looking at a color change. Now, let's talk about some of the things we see on the microscopic. These are what they call squamous epithelial cells, okay? This line the bladder, these are normal, and see how big they are? Now these are red cells in urine. Now these are a little crenated, but these are the red cells. These are red cells and white cells. So here's a white, these big looking things here. And then these smaller ones are the red cells. And these are red up here. And the arrows are pointing to the whites. These guys are the bacteria. You notice they look like rods, so most of the time when you have what they call a UTI or urinary tract infection, you're going to see rods. They're enterics. Let's talk about the urinary cast. This first one is a Highland cast, and that's actually normal. Sometimes you'll see it in people who exercise a lot and they just make these casts. The urinary cast is an impression, just like you put your cast on, you have a cast on your leg or your arm. It's an impression of your arm. This is an impression of the tubules, the distal tubules. Okay, this is a white cell cast right here. This is a red, and this is a granular. What happens when you have what they call urinary stasis, or the urine's not moving? This white cell cast will turn into a granular cast. Okay, so the granular is worse than the white cell. And here are some urinary crystals. Now, on this side, we find these in acidic urine. So this is calcium oxalate, going with a little cross in it. Now this right here looks like yeast. That's what it looks like, budding yeast. These are uric acid crystals. Now, in alkaline urine, you'll find these. These are what they call triple phosphate crystals. Now, these are the bad boys. This is the pathologic crystal right here, and it's called a cystine crystal. And you see this in a condition called cystinuria, and this is when you have an excessive urinary secretion of cystine along with lysine, arginine, and ornithine. And this happens, you have a defective transport system for these amino acids in the kidney and the intestine. Renal function is sometimes compromised by cystine crystals and stones. This is a CAT scan, originally called computed axial tomography. Now we know it as a CT. And it's useful in the diagnosis of tumors, cysts, abscesses, and hydronephrosis. It's an X-ray image with detailed cross-sectional views of organs and tissues. Another one is an intravenous pyelogram or an IVP. This is also called an excretory urogram. There's an X-ray image of the kidneys and ureters after injection of contrast into a vein. This provides a test of renal function and shows cysts, tumors, infections, hydronephrosis, and calculi. And renal calculi are stones or kidney stones. Now here's just an example of what an IVP would look like. So on this side in figure 1, this is normal. This shows the normal flow of urine from the kidneys through the ureters into the bladder. Now the one on my right, figure 2, this is a kidney stone right here, and it's blocking the normal flow of urine on the left. Remember, it's the patient's left, okay? So you can see this is backing up in here, and there's no urine flow into the bladder. Then we have a cystoscope, okay? This is a diagnostic procedure that's used to view the bladder, collect urine samples, and examine the prostate gland. Fluid is pushed in to inflate the bladder and allow the urologist to examine the entire bladder wall. Now the tip is lighted, and the cystoscope has a hollow channel. Okay? And the procedure is called cystoscopy. And here's just another picture. You see it's going up through the urethra. Okay, this is dialysis. So there are 2 types. We have hemodialysis. Okay, so they talk about this atriovenous fistula, and this is just when they join an artery and a vein, and it's usually the radial artery in the forearm and the cephalic vein. So dialyzed or unfiltered blood goes in to a dialyzer. They take the waste products out, and they put the filtered blood back in. Okay. Now in peritoneal dialysis, they have something called the CAPD, continuous ambulatory peritoneal dialysis. And this is when you have the dialysis solution. It's called a dialysate. It flows from a collapsible plastic bag through a catheter into the patient's peritoneal cavity. The empty bag is folded and inserted into the undergarments. After about 4 to 8 hours, the bag is unfolded and the fluid is allowed to drain into it by gravity. The full bag is discarded and the process is repeated. And I have a friend of mine who was a brittle diabetic, and she went with the continuous ambulatory peritoneal analysis because the hemodialysis really messed with her blood pressure. And the last thing is the renal transplant. Okay, so in this case we have the right kidney of the donor is removed for transplant. The kidney is transplanted to the left pelvis of the recipient. The renal artery and vein of the donor kidney are joined to the recipient's artery and vein, and the lower end of the donor's ureter is connected to the recipient's bladder. And this is called a ureteroneocystostomy. Okay? The remaining donor kidney enlarges, or another word for that is hypertrophies, and takes over almost full function. And that's it.